In this lesson, we'll take a look at the bony anatomy of the lower extremity. So from proximal to distal, we're going to see the femur first, the kneecap, which is the patella, and then in the leg, two bones, the tibia and the fibula, and then we'll finish off by taking a look at the foot. We'll see that there's seven bones called tarsal bones, then we have five metacarpals, and then the remaining bones are going to be what we call phalanges. So let's start with the most proximal bone. This is the femur, right? The femur is actually going to articulate with the hip bone, the os coxae, which is covered in a separate lesson. So the major landmarks that we want to know, the first part here, this rounded circle, is known as the head of the femur, right? We can see it here. This happens to be a right femur. This is a posterior view over here, and then this is going to be an anterior view on the left. All right, so this is going to be the head of the femur. Then we can see there's a slight indentation. This is for an attachment of a ligament that helps to stabilize the hip joint. This indentation is called the fovea capitis. Now, underneath the head, this constricted area here, this is the neck, right? So the head, the fovea capitis, and then the constricted area underneath is going to be the neck. On the lateral side, there's a big protrusion of bone here. And then we can see it on this side also, here. This is known as the greater trochanter. A number of muscles attached to that big bump there, the greater trochanter. More medial and much smaller is the lesser trochanter, so you can see that there. Now, on the posterior aspect, there's a ridge that connects the greater trochanter to the lesser trochanter. You can only see it on the posterior side. This is called the intertrochanteric crest, so this whole ridge right over here. On the front, there's a smaller ridge, a lesser ridge. This would be called the intertrochanteric line. I didn't label it. A lot of times on the models we don't see it, but there is a lesser of a ridge over here in the front. The whole middle part of the bone is known as the shaft. Notice on the anterior surface the shaft is smooth, but on the posterior surface you're actually going to see a ridge coming down. This line is known as the linea aspera. Right, so this is the linea aspera, and again we see a number of muscles attaching to that. The distal part of the femur, these two curved bones here, this one and then this one here, we see them pretty well. These are the femoral condyles. So on the outside, this is the lateral femoral condyle. I always know this is the outside because the greater trochanter is always going to be lateral and the head is always medial. It's always facing in. So this would be the lateral condyle. This would be the medial condyle. Right? You can see it to a lesser of extent here. This would be, again, the medial condyle on this one, and then the lateral condyle over here. Now, above the condyles are chunks of bone known as the epicondyles. Right? Epi means above, and then condyle is the condyle. So this big chunk of bone here above the medial condyle is known as the medial epicondyle, and this serves as a point of muscle attachment. Not quite as prominent, that big chunk of bone right there is the lateral epicondyle, right? So it's above the lateral condyle. And again, epicondyles are always there for muscle attachment. On the anterior surface, well actually let's do this one first. Between the condyles, this indentation right here where my cursor is, and then I label it on this side, there's a pretty big indentation known as the intercondylar fossa. Inter means between, and then condylar means the condyles. Ligaments such as, you may have heard of the ACL, right, the anterior cruciate ligament, that would be found inside here. On the anterior surface of the femur, there's a kind of smooth area right here for the kneecap, for the patella. So they call this the patella surface. That would be on the anterior side. And then in the back part of the femur, right above the condyles, right in here. This is known as the popliteal surface, right? This would be in the back of the knee. Here's a picture where we took the leg off and we're looking on end into the femur. So what you're actually seeing are the femoral condyles here. This is the medial femoral condyle, lateral femoral condyle. Here's that intercondylar fossa, right? That's where that ACL ligament would be. This over here, I didn't label it, but this would be your medial epicondyle here, and then this would be the lateral epicondyle over here. But what I liked about this picture is this smooth surface right here that the patella is sitting on is the patella surface, and then here's the kneecap nicely in place, right? So this whole surface here would be the patella surface. That brings us to the patella. So for our purposes, the patella is kind of a triangular bone. It's kind of flat on the top, so this would be the base, and then it's pointy at the bottom, so this would be the apex, right? This is pointing down towards your toes. And that's about all I want you to know for the patella, right? Know that it has a base, an apex, and you should be able to identify the bone. And again, we know that it sits right on the patella surface. The leg. So the leg is the bones distal to the knee, right? Everything from the knee distal is going to be the leg, and we're going to see that the leg comprises two main bones. The tibia is the one bone that's the weight-bearing bone. You're going to see it's bigger and longer, and the fibula is doesn't do any weight bearing. The tibia is going to be the more medial bone, and the fibula is the more lateral bone. And you can kind of remember that because fibula has an L in it and lateral has an L in it. So let's take a look at the landmarks of the tibia first. So up out over here, this flat surface here, and pretty much all of this where my pointer is, and then this flat surface here, again where my pointer is over here, this is going to be called the tibial condyles. Now, the femoral condyles sit on the tibial condyles, forming the knee joint. Okay, on the front here we could see again the medial tibial condyle, and then here's the lateral tibial condyle. Right, so this is an anterior view, and over here we're seeing the back side. A little bit visualized better on the posterior view here. Between the two condyles is a raised area right there. That raised area is the intercondylar eminence. Inter means between, condylar means the condyles, and an eminence is something that is raised. Right? So this is actually the attachment point for some important ligaments, the cruciate ligaments. Like I said before, the anterior cruciate ligament that runs through the knee actually attaches here. Okay, so we have the lateral condyle here, medial condyle. Again, how do I know medial and lateral? The fibula is always lateral. That's always going to be on the outside. Now, there's a big bump right about here. If you would kind of go down on your shin bone, right, your tibia, right below your kneecap, you're going to feel a big bump in the middle of the anterior surface of the tibia, right about here. This is called the tibial tuberosity. This is actually the attachment point of our quadriceps muscles that are coming down from the thigh. The long part of the tibia here is the shaft, but the shaft is actually pointy in the front. It actually comes down to a point. This is known as the tibial crest, or you can call it the anterior margin. Right? By the tibia being more narrow in the front, it actually gives it more strength to help support our body weight. Now, down near the distal end, there's a big bump on the inside of your ankle. If you kind of reach down now and just kind of touch that big bump on the inside of your ankle, what you're feeling is this bone that I'm pointing out right here. This is known as the medial malleolus, right? So that's the big bump on the inside of our ankle. The fibula lies up against the tibia, so there's a notch. It's a little bit hard to see when the bones are in place, but there's a notch right here. You can see a little bit. If the fibula was away, we'd be able to see it a little bit better. It's fairly deep. That is known as the fibular notch, and it allows the fibula to lie up against the tibia. We actually call this joint, I believe I have it labeled for you, we actually call this the tibiofibular joint, right? So there's that joint right there, and that's going to be the inferior one, and then there's the same thing up here. This is going to be the superior one. It's just the joint between the tibia and the fibula. On the underside of the tibia, like right about here, where the ankle bone, the talus, is going to articulate, that is known as the articular surface. Okay, so the landmarks you need to know: the two tibial condyles, in between the intercondylar eminence, on the front, right at the top of the shaft, is a big bump. And try to feel it on yourself. That is the tibial tuberosity. Then we have the shaft, and there's a sharp edge to the shaft in the front. This is known as the tibial crest or the anterior margin. Then there is a indentation, right, a notch for the fibula to sit up against the tibia. This is known as the fibular notch, right there. And we don't really see it well on this side, but it's over here also. Then the big bump right over here, medial malleolus, right? That's the bump that's on the inside of your ankle. And then the articular surface right over here, the whole underside of the tibia, this is where the ankle bone is going to insert right here. This is going to be called the articular surface, right? And again, it's going to be a nice articulation for our ankle so that we can, like a hinge, lift our foot up and drop our foot down. Now, the fibula just has three landmarks that I'd like you to know. The fibula at the top, this rounded area here, is known as the head. The long middle part is just going to be called the shaft. And then if you go down and feel by your ankle, guys, on the outside, this big bump on the outside is the lateral malleolus. Okay, so the three parts I want you to know are head, shaft, lateral malleolus, right? And that's of the fibula. So now you can see the two malleoli, right? Here's the medial malleolus. Here's the lateral malleolus, right? This is the bump on the outside of your ankle. This is the bump on the inside of your ankle. And now, nicely, like I said in a minute, we're going to look at the talus bone. That talus is going to sit right inside there, and we'll have a nice hinge joint to move our foot, kind of like taking your foot up off the gas pedal and then pushing your foot down in the gas pedal. That swinging motion actually happens right here. So in the foot, we have the ankle and then kind of the rest of the foot. The ankle consists of 7 tarsal bones, right? So you can see here 1, 2, 3, and there's actually 3 more, 4, 5, 6, and then number 7 over here. This is a side view. So what I recommend doing when you hold the foot up in the lab, look for the bone that sticks up right here. This one is called the talus. This is what's commonly called the ankle bone. This talus is what goes in this space right over here. So we have, like I said, a nice hinge joint there. So that's the bone that sticks up high. It goes up high, and then forming the heel back over here, right? It would be like this region here on this skeleton. This would be the calcaneus, right? So the talus, the calcaneus. Then I would recommend looking at the foot from above, right? So here was the talus that was sticking up. Here's the heel bone. Everything else is going to be in front of these two bones. So watch this. In front of the talus, we're going to have the navicular, which means boat-like. It kind of looks like a boat. Then there's 3 bones, all named the same thing. They're named cuneiforms. There's the medial cuneiform, the intermediate cuneiform, and the lateral cuneiform, right? So medial, right, in line with the big toe, right? If you look down at your big toes are always medial, intermediate, and lateral. And then the last bone here, kind of like a box, so they call this the cuboid, right? So that's going to be lateral to the lateral cuneiform, but it's also anterior to the calcaneus, right? So the 7 tarsal bones: talus, calcaneus. Once you find those, in front of the talus is the navicular, and then three bones, all named the same, cuneiform: medial, intermediate, lateral. And finally, right here, this box is the cuboid. The remaining part of the foot is going to be like this, very similar to the hand. These bones right here, there's five of them. They are known as the metatarsals. Right, so those are the metatarsals. And then if you notice on the great toe, there are two phalanges attached to the great toe, just like the thumb, a proximal phalange and a distal phalange. But the remaining toes are going to have each one, two, three phalanges: a proximal phalange, a middle phalange, and a distal phalange. Just like the hand, we number the toes. Instead of saying, say you were documenting something, you wouldn't say, the patient injured their big toe. I mean, you wouldn't be wrong, but we typically say toe number one. Right? This is second toe. The middle toe there is the third toe, right? The fourth toe, and then the pinky toe, right? We would call the fifth digit, right? So we have 5 digits, just like the hand. Okay, so this is just a medial view. You're kind of looking at just at the inside of the foot, so you can see some of the same tarsal bones that we just looked at. You'll also notice that the foot, if you looked at your own foot, unless you have flat feet, there's going to be two arches. There's an arch that extends the whole underside and length of the foot. This is known as the longitudinal arch. And then there's an arch that goes across the foot, known as the transverse arch. These arches help to absorb some of your body weight as it gets transmitted down into the ground. So we actually need these arches to walk properly. Okay, so that concludes this lesson, right, where we looked at the bony anatomy of the femur, the patella, the tibia, the fibula, the 7 ankle bones, the metatarsals, and the phalanges.